So it's been nearly 2 weeks after the eruption of a volcano in the northeastern DRC. Many people are struggling to survive. Hundreds of thousands fled their homes and took nothing with them. Despite ongoing seismic activity and official warnings, many displaced people are returning to Goma, searching for food, water and medical care. MSF says humanitarian aid is still urgently needed. We chat to the head of the mission in the DRC, Magali Roudaut. Thank you for joining us, Magali. Please, will you give us a real sense of what the situation is at present in Goma?
Well, the situation in Goma and in the surrounding areas is still very unstable, as people are still on the move after the 22nd of May and the eruption, and following the subsequent order of the government for the population of Goma to evacuate. There had been 400,000 people reported on the move and going in different directions, going towards Rwanda for some, or Rutshuru, Minova, South Kivu, Bukavu, and in North Kivu in the surrounding 30 kilometers from Goma, the city of Sake. So we are hearing about people returning. In the meantime, there's still a lot of people that are in the move and that are still outside of Goma, waiting for any instruction or guidance from the government, whether they can come back or not. So we have been intervening in different parts of the surrounding Goma area, like in Sake or in Rutshuru, to support the displaced people.
Now, I know that the lava has stopped, and so there might be a short respite from the real danger of the volcano, but there's still danger from gas. What is the impact that gas has on people in the area?
Well, we're working on it. For our perspective, we are following also the information that we receive from the government of Goma and from the experts also. But yeah, this is not our expertise. Our expertise is that are currently in difficult situations. Still, there are some reassuring information coming towards us, towards the population in Goma, that the same thing could happen in the near future.
Now, clearly, you don't have everything you need to support and help those people who are in desperate trouble at the moment. What are you specifically looking for, and where is that aid coming from?
International community and the humanitarian community that have been working on supporting these displaced population. We as MSF, we've been focusing also on disease prevention, and in particular cholera prevention, as these Sake, for example, and Goma also is endemic to cholera. So therefore, we have in the very first day of this displacement, and we have ensured free health care for the population in Sake, for example, and we have also been providing water, clean water, in a very urgent manner. This was crucial in the very first day to avoid the cholera epidemic. So we're still working hard on it with some other actors also. And there's need for big mobilization as the people will also return and are also returning, and supply of water in Goma has been disrupted because of the lava eruption that has damaged some water supply system. So this is a very important part of the response to act very quickly in providing people with clean water.
Now, is the problem also being exacerbated by COVID-19? Is that also a problem in the region?
Well, this is of course the pandemic is still present, and COVID is also still present in the region. So yes, it is definitely an issue, and then it has to be also. The fight against COVID has to continue. We've been trying to provide also health messages for the population that were displaced also. Of course, it's very difficult for people to act on it when you're living in a crowded conditions, poor living and hygiene conditions. It's then very difficult to ensure proper measures.
Thank you for your time. Magali Roudaut is from Médecins Sans Frontières.